In today's Health Watch, it is American Heart Month. We love Heart Month. So good, so important. They say what is good for the heart is good for the head. Our chief medical correspondent, Jon LaPook, is here to explain why that's more than just a saying. Good morning, Dr. LaPook.
Good morning, Adriana.
So explain to us the connection between heart health and head health.
Well, this is a big deal because so many of my patients in my internal medicine practice are just terrified about dementia, as we all are, and more than really any other problem. So there's a couple of things. First of all, there's something called vascular health. So the heart pumps out blood to the whole body. We all know that, but it also pumps blood to itself. So if those blood vessels have a problem, then the heart itself has a problem. In addition, the heart is pumping blood to the brain. The brain weighs, I just looked this up, 2% of the body weight. It gets 15% of the blood flow.
Wow.
So
a lot of fuel.
A lot of fuel. We need to have a lot of blood flow there. So that's one thing. So if something goes wrong with the heart, you can have a heart attack. You can have a decrease in the pumping. You can have an arrhythmia like atrial fibrillation that throws a clot to the brain and causes a problem. But in addition to that, and it's a little complicated. I mean, I did a deep dive on this, and it's more complicated than you might think. The blood vessels itself, inside the heart and inside the brain, can be affected by all sorts of problems like high blood pressure or high cholesterol, diabetes, obesity, lack of exercise. So, this is why we're telling people what's good for the heart is good for the head, for real.
So you can fight dementia or your risk of dementia by keeping your heart healthy.
Yeah, and I just was in communication this morning with Risa Sperling. She's a world's expert on Alzheimer's, and she said that there's a huge overlap in terms of mixed dementias. So a lot of people who have Alzheimer's also have a vascular component. And so it's sort of, belt and suspenders there. You could have amyloid in your brain.
What is that?
Amyloid is the gooey substance that's seen that you have to have in order to have Alzheimer's. And yet you may not have symptoms. We don't know if it's that you're going to eventually, and maybe that's going to happen, but maybe you can help stave it off by having good vascular health so that the blood supply there is good. And there's something else that's fascinating, okay? This is my favorite thing about this whole thing. There's something called the garbage collecting function.
Okay.
So
this took a turn.
We all say, right, so we're gonna talk about garbage collecting. Sleep is important in terms of dementia and heart health and things like that. During sleep, the toxins that are in your brain get removed, including amyloid, the substance that we just talked about, and other toxins. And it's called the glymphatic system, the lymph system. And it turns out, and this is a mouse study hot off the presses 2 months ago, when you have heart failure, you decrease that system. So that's another connection that says that, first of all, not only do you need a lot of sleep, if you don't get good sleep, that removal of toxins doesn't happen the way it should. But if you actually have a heart attack, it's possible, if you have heart failure, that whole lymphatic system that's draining the head of the toxins might not work well. So yes, big connection between the heart and the head. You gotta have heart.
You gotta have heart. You have a big heart, Dr. LaPook.
Thank you, sir.
Another reason to exercise. My household cardiologist says 150 minutes a week of cardiovascular exercise, right? Cardio?
Yeah, I mean, as much as you can. People, more is better with this. You don't have to go crazy, but I just switched on the elliptical from 30 minutes to an hour. You start
okay, Dr. LaPook.
You start in the morning and you just read in, and by the time it's over.
Yeah. Start a little and you can grow.
Exercise.
Thanks, Dr. LaPook.
Thank you, Dr. LaPook. Appreciate it.